Hi, this is Lynn Leach with Intuitive Hands Physical Therapy. I wanted to take a moment to let you know what it is that I'm planning on covering for this upcoming course for labor support personnel. What I found is I've worked a lot with women who are pregnant and having pain in their back is that these women come into me with a pattern in their pelvis and also their baby's kind of shifted off to one side. And after working with them, I'm able to relay that information of what I'm finding in the pelvis to the midwives and doulas and recommending different positions for this woman's labor that is going to be more beneficial for them and also recommending positions to avoid as well. So what I'm finding is that our pelvis here has different patterns that they can go into. These are our iliac bones, and these can rotate forwards or backwards. And depending on the position of this pelvis is going to impact the labor and the positions that moms get into. And so I would like to share with you my PT knowledge of how to palpate these bones and find out exactly what the pelvis is doing for the moms. And by understanding the position of this pelvis, you're going to be able to understand the positions that will benefit this mom to have an easier delivery. So if the iliac bone is rotated forward, going into a position that causes that bone to go even more forward is going to be counterproductive. So what I'd like to do is help you to learn how to figure out what's happening with the pelvis and help you to figure out the best positions to counter those and then be able to help the mom have an easier birth. Um, Also, that's one aspect of the class. The other aspect is that I would like to share with you some of the pre-existing conditions that moms may be carrying around that they're not even aware of. Issues like car accidents or tailbone issues are definitely going to have an impact on a woman's birth. And so by you understanding what these pre-existing factors are, what can be done about them, and how you can help your moms have an easier birth by dealing with these beforehand, before they go into birth, it's going to be a lot easier for them instead of figuring these things out while they're in birth, which sometimes they don't even realize that they have these issues. So I'd really like to let you know about those. And then the third thing to help moms have a faster recovery is to really help them figure out how to deal with their abdominal muscles. I've been working with moms trying to help them to heal the diastases that most pregnancies cause. And there's things that they can do that can prevent that from happening or at least minimize the separation going on. And so by you having that information, you're going to be able to share that or impart that information to your moms that you're working with and help them to have an easier recovery and a faster recovery. So those are some of the things that I'd really like to share with you at this course on February 4th. It's going to be in Boulder at the Cafe of Life, and we're going to start at 10:30 and be done by 5 or 5:30. And I would love to have you there because my whole goal, my whole purpose for doing this is to really help moms have an easier birth and a faster recovery. And with your help, I know we can make that happen.